My name is Scharman Grimmer, and I am the mother of 5 children. All 5 of my children are athletes, and in order for them to play sports in high school and junior high, I have to go on and register them on Register My Athlete. And I have to read all of this information about concussions, and I have to sign saying I understand what a concussion is, what the symptoms are, everything from vomiting to dizziness to headache to sleeping too much to not being able to sleep at all, just all of these different symptoms that a concussion can be. 4 of my 5 children have sustained concussions. 2 of them have sustained severe concussions. And it was my eldest daughter, Emmeline, sustaining such a serious concussion that it affected her language center of her brain. And she was not able to speak in complete sentences, had a hard time with word retrieval, and had all of the other symptoms of a severe concussion. And that was terrifying as a parent. We looked at many different clinics in the area, many different doctors. So through the help of a friend who was a current patient of Dr. Hatch's, that began our journey in association with Dr. Hatch. As we met with him on our first meeting, he was able to assess where she was and what the damage was and which area of the brain the damage was through a variety of testing, through the eye testing, through the balance testing. And that was so comforting as a parent to see on paper the explanation of where her brain was and why she was having these particular symptoms. We can see improvements, we can see regressions, and then Dr. Hatch is able to make the great recommendations based upon those tests. And so Emmeline was able to get very specific brain exercises and treatments that she was able to do. Some she did in the clinic, but most she did at home. And she was able to do intense treatment over those first 4 weeks after her brain injury. And we were able to see remarkable differences. She dropped out of school for about a month. She wasn't able to go to school. And then at that time, she was only able to go to school part-time for the rest of her senior year. So it was very impactful. I'll never forget the day when Dr. Hatch looked at her and said, "Emmeline, you have healed from your concussion." Her tests showed that her balance was right on, that her eyes were tracking correctly and dilating correctly, and that her reflexes were right where they needed to be. And it was exciting, and we could definitely tell that she was able to do better in school. Her energy level increased. He then looked at her and said, "This is what I've been waiting for you to heal from your concussion so that we can tackle what you have battled your entire life, which is your anxiety." Our oldest daughter has suffered from debilitating anxiety and depression really from a very young age. So then Dr. Hatch was able to turn his knowledge, his expertise, to her anxiety. And through the exact same types of tests, he was able to look at other areas of her brain to see where things were not firing correctly. And through similar but different exercises that she is able to do in the comfort of our home or in her apartment, she's now in college, she now has learned from Dr. Hatch many self-care techniques to help with her memory when she's about to take those midterms or those finals, or when she's transitioning, because transitions can be hard, and in a young adult's life, there are a lot of transitions. She has had a remarkable improvement. In fact, we've been so excited because she is not taking as many prescription medications, and she has been taking some of these medications for a very long time. And in order to help her function and be the best that she can be. She is a highly functional young adult. You would not know, visiting with her or seeing her in a college setting, that she has had these struggles with depression and anxiety. So as we were going through this with our oldest daughter, all of a sudden, as a mom, I kind of checked out and I realized our second daughter, who we knew had sustained 3 concussions in very quick succession, I knew she had not fully healed from these concussions. I immediately called Christine and said, "We need to get our second daughter in." And then we realized through testing that yes, in fact, she had not fully healed from those 3 concussions. And Dr. Hatch was then able to start working with her. And interestingly enough, they had both sustained concussions, but they were different areas of their brain were damaged. And so they were able to do individualized exercises, which again helped us feel confident in the treatment that they were being given. So I've had 2 of my other 5 children sustain concussions. One, my youngest son, sustained a concussion playing football and soccer, having a goalpost land on his head. Again, not horrific like my oldest daughter, but still enough symptoms that we were concerned. And then my oldest son, George, sustained 2 concussions with soccer, and he also did falling off of a tube while we were at Lake Powell. So those were pretty mild, but I really do feel like if we hadn't gotten my son in right away, the symptoms would have grown and gotten worse. And so while they were mild, I feel that is because we know what to look for now in brain health. And we knew immediately that he had had a concussion, and we were immediately able to get him in. One thing I'll share about, George has Tourette's syndrome, and it was diagnosed back in 3rd grade. And his first tics were full body tics. They looked like seizures. And we worked with an amazing child psychiatrist up in Salt Lake. We had been working with her for a couple of years because he had already had some sleep issues and some mood regulation issues. And so we knew something was going on for George, but we didn't know that it was Tourette's, and this is all linked together. So through working with Dr. Hatch, we have been able to minimize George's tics. And here he is in the middle of puberty, and that exacerbates tics and causes tics to really come out. He has had everything from full body tics where his whole body shakes, to eye tics, to face tics, to humming tics, to making noises in the back of his throat tics, to pulling his face. Those are the main tics that we've seen. His tic cycle, which is not uncommon for Tourette's, and it is very important for us to stay current with Dr. Hatch so that we know which exercises George should do based on how his brain is doing and what tics are presenting. We have been able to get George off of all medication, all prescription medication, and have been able to address it just through the exercises. Along with his Tourette's, often comes with misophonia. And I actually have 2 children, one with Tourette's who has misophonia and one who has ADHD, and she has misophonia as well. And misophonia is when they are very sensitive to sound. So if we're driving in the car and a brother is tapping a straw on his fingers or making a clicking sound or chewing on something, my son with Tourette's with misophonia just can't handle it. It just throws him over the edge. We've done everything from trying to get noise-canceling headphones that he can wear to help calm him down. But that is our most recent area that we're working with Dr. Hatch on, because Dr. Hatch is one of the leading experts in the country on misophonia. And he's the one that even helped me identify what these 2 children have, because we just thought that they had sensory integration disorder and that they were super sensitive auditorily. And come to find out that there is a name for that. It's called misophonia. And so that is something that we are currently working with Dr. Hatch for our family. I also want to say a little bit about mood. Moods can be greatly altered, and you don't always link it to the hit to the head, but it can come up a week later, a month later. Not every concussion will have every symptom. So it's just so important anytime you take a jar or a fall or a hit to the head that you come get checked out. Even if you think, oh, they're fine. Oh, he seems fine. She seems fine. I just had my mother, she's a 67-year-old woman. She's also a patient here at the Brain Rehab, and she has neuropathy in her feet, and she just took in the fall 2 horrific falls and had 2 major concussions. She felt at first that she was fine, but then she said to me, as the weeks went on, as the months went on, the fog just got greater. And she realized that yes, it was indeed because of her concussion. So my message to families, to parents, both professionally, but as a mother who has 5 children who have all had various needs in the mental health field, but also just in health and well-being neurologically, is that it's tricky to always know, is this from a condition? Is this from a concussion? Or is this bad judgment just because they're teenagers? And I have really appreciated Dr. Hatch helping us kind of separate out what is normal behavior for a teenager, and this is normal development, and this is from a condition like a concussion. So I truly send the message to families, if you are still searching, come try. I think you will find what you're looking for at the Brain Rehab if any of this resonates with you.